As respiratory viruses make their seasonal rounds, doctors across Canada are noticing a troubling trend, an uptick in serious lung infections, particularly double pneumonia. Unlike regular pneumonia, which typically affects just one lung, double pneumonia hits both lungs at the same time. That means double the inflammation, double the fluid buildup, and often a very much tougher recovery. Earlier, I was joined by Dr. Abhishek Raut, medical director at Appletree Medical Group, who explained what double pneumonia is and what causes it.
Double pneumonia is a term we use when we see that an infection, which can be caused by multiple things, bacteria, viruses, or even fungi, affects both lungs rather than just one. So, in a typical case of pneumonia, we just have one lung or even a single lobe of a lung that might be involved. And the rest of the lungs, including the other lung, has the opportunity to compensate for that impaired side. When both lungs are involved, as is the case here in double pneumonia, that body's ability to exchange oxygen is significantly compromised. So you would have a more severe respiratory distress and a higher risk of complications as well. Right. So with double pneumonia, it's generally caused by the same pathogens that will lead to a conventional pneumonia. But we will see that there's a difference in presentation, as in because we have an infection affecting both lungs, it's going to have a more significant and more extensive involvement. The most common culprits are bacteria like Streptococcus pneumoniae, Haemophilus influenzae. And for viruses, we certainly have very classical ones, influenza, as well as the COVID-19 virus as well. Less frequently, we will also have fungal infections that can cause it as well. So, in essence, it's not that double pneumonia comes from a unique set of pathogens. It's more a reflection of that infection's ability to spread and the body's response to fight it.
We also discussed the symptoms of double pneumonia, how quickly the illness can escalate, and what the treatment process looks like.
Double pneumonia involves infection of both lungs. So typically, what we will see is classic symptoms of pneumonia still, but in a more severe, quickly escalating manner. So the individual may notice a persistent cough, which might be productive, and then accompanied by thick, sometimes even colored mucus. It's common to see high fevers and chills as well, which is the body signaling to mount a stronger response. But when the infection does get hold in both lungs, we start seeing shortness of breath becoming much more prominent as well. And that's because of the body's ability to oxygenate the blood is being compromised there. We'll start seeing fatigue, chest pain as well. But the concern here is how quickly it can happen as well. So in some cases, when we have a weakened immune system, what can start off with a cough can very quickly deteriorate, sometimes within 24 to 48 hours, into more severe respiratory symptoms, and more severe meaning even experiencing confusion or even a bluish tint in the skin, which we call cyanosis, due to the hypoxia as well. So it can very quickly deteriorate in the double pneumonia case. So treatment for double pneumonia is really driven by what the underlying cause is. So if it's bacterial, viral, or fungal, and of course the severity of the infection. Because double pneumonia presents with bilateral involvement of the lungs, it certainly is a significant threat to oxygenation. So hospitalization is often recommended in these cases here, particularly in individuals who have immune compromise or the elderly. In hospital, we would typically look at intravenous antibiotics if the cause is bacterial. But we can also provide supportive oxygen therapy to support the breathing and fluid management as well. But not all cases do require hospitalization, and we do have certain risk assessment tools that we use as physicians, like the Pneumonia Severity Index, which helps us determine what the appropriate level of care would be for that individual.
Dr. Raut unpacked who is most at risk for developing double pneumonia and how long the typical recovery process is for someone who has contracted it.
Double pneumonia will tend to develop in individuals who are already vulnerable because of a number of given factors in the body's mechanisms. So the most at-risk groups are the elderly, particularly those over 65 years of age. What we also see is people with chronic obstructive pulmonary disease, COPD, heart disease, and diabetes also will have compromised immune systems. We also see patients with HIV or cancer treatments who also have very immunosuppressed systems as well. We do know lifestyle factors can play a role, such as smoking, which can impair lung function. And so all of those factors will collectively explain why double pneumonia is more likely to occur in certain individuals rather than others. So the recovery for double pneumonia is a process that can really vary widely depending on several factors, including that severity of infection and the patient's overall health. We do know it is associated with a much higher mortality than pneumonia in general as well. And so that is something to keep in mind. But the recovery process, assuming everything is going well, can span from 2 to 6 weeks. If the infection is quite severe, sometimes we do need several months for full recuperation as well. And this is assuming that the patient has access to the IV antibiotics, oxygen therapy, which we're able to do in Canada, but certainly not in many other countries.